Hello everyone. We have already discussed about the hypoglycemia in diabetes mellitus in its first part of presentation. So let's discuss further about this in this second part of this presentation. This second part is about the special problems in hypoglycemia, and these special problems are asymptomatic hypoglycemia, nocturnal hypoglycemia, hypoglycemia unawareness, and reactive hypoglycemia. So let's discuss one by one. The first special problem is asymptomatic hypoglycemia. So in this condition, there is evidence of hypoglycemia, means the glucose level is below 70 mg per deciliter. However, the patient is not aware about this condition of hypoglycemia, as well as he doesn't have any kind of symptoms related with the hypoglycemia. If such asymptomatic hypoglycemia is occurring recurrently, so such condition is known as impaired awareness of hypoglycemia. Let's discuss about the another problem, that is nocturnal hypoglycemia. So this nocturnal hypoglycemia is mainly due to the lack of effective constant basal supply of insulin combined with long period of fast hypoglycemia and diminished by lying flat and sympathoadrenal responses and inhibited by the slow wave of sleep. In a very simple way, the nocturnal hypoglycemia can be defined as any hypoglycemia which is occurring during sleep is known as nocturnal hypoglycemia. And this nocturnal hypoglycemia is very common and frequent with if any person is using CSII, continuous subcutaneous insulin infusion, and if any person is taking basal bolus regimen of insulin. As there are reduced sympathoadrenal responses to hypoglycemia during the sleep, so because of that the patient is less likely to be awakened by the symptoms of hypoglycemia during the sleep. And this nocturnal hypoglycemia is common in those who consume alcohol in the evening or if they consume alcohol before the bedtime, and so this condition increases the risk of nocturnal hypoglycemia. Let's see what are the symptoms of nocturnal hypoglycemia. So person with nocturnal hypoglycemia may have symptoms like nightmares, poor quality of sleep, restless during the sleep, night sweating can be there. He may feel morning headache. Apart from that, some other symptoms are also there, like increase in muscle tone, chronic fatigue, mood swings, enuresis, that is most likely in children, and sometimes person can also develop convulsions. Let's see what are the risk factors for development of nocturnal hypoglycemia. So first one is hypoglycemia unawareness, means person is having hypoglycemia but the person is unaware that he is having hypoglycemia, and also the person doesn't show any kind of symptoms. If any person uses insulin, meglitinide or sulfonylureas, in such person nocturnal hypoglycemia is very common. If anybody does long and intensive exercise, in such condition also the nocturnal hypoglycemia is very prevalent. Which the fourth one, which we have already discussed, is alcohol consumption before bedtime or in the evening. If any person is having frequent hypoglycemia, that is severe during the daytime, in such person there is higher chances of nocturnal hypoglycemia. As well as if person feels low blood glucose during the daytime, in such persons also there is higher risk of developing nocturnal hypoglycemia. How we can prevent or predict the condition of nocturnal hypoglycemia. So nocturnal hypoglycemia can be predicted and can be prevented by measuring bedtime blood glucose level, bedtime self monitoring of blood glucose. The second method is by using non-invasive intermittent device which measures the falling level of glucose during the sleep. As we know that any person who is having nocturnal hypoglycemia have very less chances that he will awake by the hypoglycemia. So this method are required so that we can measure the level of blood glucose. So how this nocturnal hypoglycemia can be managed, can be prevented? For that we need to measure the blood glucose level at 3 am, as 3 am the nocturnal hypoglycemia is very common. Second one is to advise the person to have snacks at bedtime which will maintain the level of glucose throughout his sleep during the night. Third one is the reduction of the dose of insulin at the night. The fourth one is giving the basal insulin before the bedtime instead of before the dinner. This will also lead to lower the risk of nocturnal hypoglycemia. Apart from that, relaxing the control of fasting blood glucose levels. And the last one is use of long acting insulin instead of short acting or bolus form of insulin. Let's discuss about some other hypoglycemia, hypoglycemic abnormality, that is hypoglycemia unawareness. So this hypoglycemia unawareness is a condition. It has reduced ability or failure to recognize the hypoglycemia like condition by any individual, and this level of hypoglycemia in which the person is unable to recognize is the level of glucose where the usually symptoms are developed, but the patient doesn't recognize about the symptoms of this hypoglycemia and he is unaware about the hypoglycemic condition. And this hypoglycemia unawareness can also cause neuroglycopenia. Glycopenia means there is low level of blood sugar level in the neuronal or brain tissues, and because the neuroglycopenia has been developed, so person can feel the symptoms, but these symptoms are developed at very low level of glucose. So to diagnose, to prevent such condition, we need to use the non-invasive intermittent devices. This hypoglycemia unawareness is seen in those who are having diabetes for a very long duration and those who are having good glycemic control. And the probable cause for the development of hypoglycemia unawareness is that the protective nature of glucagon, it starts failing as the person is having long duration of diabetes. So the cope up mechanism for the hypoglycemia starts failing. Apart from that, there is decrease in sympathoadrenal response, so that any person can diagnose the hypoglycemia level. Apart from that, person starts developing incident hypoglycemia, and this leads to upregulation of the neuronal glucose transport, and because of this neuronal glucose transport, there is blunting of subsequent hypoglycemia. The patient who is having autonomic neuropathy, they have some additional defect in release of epinephrine, and we know that this epinephrine is one of the counter regulatory hormone against the hypoglycemia. Apart from that, there is increase in angiotensin converting enzyme levels. So all this condition contribute to development of hypoglycemia unawareness. So let's see this hypoglycemia unawareness can cause which effect? So this hypoglycemia unawareness can cause autonomic neuropathy. The person who is having hypoglycemia unawareness can develop cerebral function compromise, and this cerebral function compromise is due to neuroglycopenia, low level of blood glucose in the neuronal tissue. And the presentation for this cerebral function compromise can be as confusion and coma of the person. There may be loss of end organ response against these counter-regulatory hormones which act on the liver, adipose tissue, skeletal muscles to cope up with this hypoglycemia. Also, there may be lack of sympathetic response against this hypoglycemia. Apart from that, there may be generation of a condition known as hypoglycemia associated autonomic failure. Let's see how this hypoglycemia unawareness can be prevented. So the first and most important is the patient education about the symptoms, about the method of recognition of this hypoglycemia unawareness. The second one is the training of the individual for recognition of the neuroglycopenic symptoms. The third one is the review of other aspects of the management. The fourth one is we need to avoid the tight control of blood glucose. The last one is use of continuous glucose monitoring, so that we can continuously monitor the level of glucose and we can detect if it goes below the threshold value. Let's discuss about other condition which is known as reactive hypoglycemia. So this reactive hypoglycemia is a very uncommon phenomena which is seen on overweight and obese individual. In this condition, the patient complains of hypoglycemic symptoms, and these hypoglycemic symptoms are developed after 4 to 5 hours of consumption of carbohydrate rich meal. When we do the oral glucose tolerance test in such individual, we found that there is rapid rise in glucose level just 30 minutes after, or 30 minutes to 1 hour after the glucose load. However, this glucose level starts accelerating through 4 to 5 hours later the consumption of carbohydrate level. So why this reactive hypoglycemia condition develops? And this is due to the lag in the insulin secretion, and it is followed by the excessive secretion of the insulin in response to carbohydrate intake, and which ultimately causes the generation of hypoglycemia. And so how this reactive hypoglycemia can be treated? This can be treated by the reducing the weight of the person, and also we can motivate the person to for intake of small and frequent meals. But many of these reactive hypoglycemia person have higher chances to develop type 2 diabetes mellitus. So we have reached to end of this part of the presentation. For further details, please follow the third part on the hypoglycemia part of this presentation. Thank you so much.